We're in the chart for our patient Snow White, and today we're going to make an initial or master treatment plan for Snow White. This training video is specific to therapists and perhaps nurses in the outpatient setting. We're going to come up here to the tab Treatment Plan and select this. If you're working in the outpatient setting, you can skip this column. This is for inpatient workflow. We're going to come over here to section number 3, and we're going to add a new problem by clicking this button. We have 3 different types of problems in the program: psychiatric problems, and they're listed here. We have nursing problems, which are mainly medical problems that the patient might have. We also have social problems, separate list for those. Let's come over here to the psychiatric or psychological problems. And as a therapist, I'm going to come down here and say that my patient's problem is anxiety. And it's manifested by generalized anxiety disorder with avoidance of social activities. Okay. The problem that we've identified up here is going to inform the types of long-term goals, short-term goals, and interventions that the program shows you and that you can choose from. In ICANotes, you only need to select one long-term goal. And I'm going to say that her long-term goal will be to return to her baseline level of functioning. The program has put that sentence in, and I'm going to give her 6 months to get to there. Roughly 6 months, and insert that target date in here. We're going to come forward into the short-term goals. The patient's generalized anxiety disorder has been pushed forward into here. When I click on it, it's going to show behaviors that we want the patient to change in the short run relative to her generalized anxiety disorder, and maybe specifically to her avoidance of social activities. We have lots of options here. Okay, we've now just landed in the short-term goal portion of the program. Information that shows in here has been informed by the patient's problem, and more specifically by the avoidance of social activities that's a problem right now for Snow White. So when I click on generalized anxiety disorders and then I come down here, I might want to say for her short-term goal that she will have anxiety symptoms less than about 50% of the time per day. And I want her to, I'm going to give her a month to meet this short-term goal. I'm going to put this date over here, and it's going to insert it into the program. So short-term goals are measurable goals, and that's why we allow you to put in this specific information here. I can also come up with another short-term goal with her. Maybe I would like her to, let's see here, something, maybe we can find something specific to her social activity. We'll attend a social activity at least 1 to 3 times per week. And I'm going to give her that same period of time, about a month, to meet that short-term goal. Let's come over here to interventions. Therapist interventions are already selected here. We're going to have the therapist or counselor train the patient in anxiety control techniques. Okay. And you can put down the frequency here. Maybe you're going to be doing this once per week for a 45-minute session. And if you'd like, you can put down your initials here. I'm just going to put down my initials. And I'm going to pick out a second intervention. A therapist will confront, as appropriate, anxiety-producing ideas with reality-based interpretations. And you're going to be doing that also during that same counseling session once per week for 45 minutes. Now we're going to go forward to plan strengths. And for her plan strength, I'm going to say that her family is her source of strength. She has strong family ties, the ability to use family support, and she has a good relationship established with her family. In terms of barriers to her treatment plan, let's say that motivation is a problem for her right now, and that therapy will focus on motivational problems first. I'll select this sentence, set it into the note. and move forward. We're now ready to compile our plan. So when you're working in the initial treatment plan or master treatment plan, sections 1 and 2 on this tab, complete plan, sections 1 and sections 2 are for follow-up plans only. So you can skip those, skip and skip. We're going to come over here and start with number 3, and we're going to be putting information in here under our status text. I'm going to say that I met with this patient on a face-to-face meeting to work with him or her in developing this treatment plan. The other 3 choices are really more relevant for prescribing clinicians. We have a status update that you can put into this portion of the program. It's optional, but maybe I'd like to come in here and put in a snap scale into my master treatment plan. Let's take a quick look at this. Okay, so these are patient-identified strengths, needs, abilities, and preferences that she shared with you during the treatment plan meeting, and you can document those as such. So I'm going to say Snow has told me that her strengths are her family support and her spouse or significant other. What needs does she have? She would like somebody to explain her diagnosis to her. What abilities does she have? She says she can accept criticism, she can ask for help, and she can be honest in group sessions. What are her treatment preferences? And for right now, she says she's just interested in group therapy, or excuse me, individual therapy, but maybe she's interested in group therapy. She says perhaps in the future, so you can put that down. I could come in here and click, for instance, she has issues with social anxiety. What are her specific goals? Maybe she wants to get back to work, and her desired outcome, she might want to learn how to manage her feelings more efficiently or more effectively. Okay, we're going to come back. You can do we have an area here that you can go into and do discharge planning if this is relative to your practice. Otherwise, I'm going to come down here and compile the plan for this program. If I wanted to add a second problem to this master treatment plan, I could do it at this time instead of compiling this problem. I could come up here and add a new problem and go through the workflow again, pick out a different problem, work across each of these tabs, and then compile the 2 problems that were in the master treatment plan. But for right now, we're just going to work with our anxiety problem. So I'm going to click here. Our anxiety problem is showing down here. And we're going to come back here to the, go back to the comprehensive treatment plan. We're not quite done with this note yet. So you can see our problem for anxiety is showing here. I'm just going to label it as problem number 1. From here as well, you could add an additional problem if you needed to. If you make a mistake doing this master treatment plan and you said Snow White has anxiety and you were mistaken, she actually has depression, you could click this icon and just put all of this information right into the trash can. Once she has met her short-term goals and her long-term goal, you do not delete the problem, rather you designate that by putting an X in here. And just to show you here, X indicates an inactive problem that will not be included in the compiled note. So you'll have a record that she has did all the work for this problem, and there'll be a line through it, but you'll be able to see that this was a former problem. Right now it's an active problem, so I'm going to deselect the X here. I can come down here and say that this note was done today, January 21st, for example, and that maybe I want to update this in couple of weeks, maybe on February 11th. So this is setting this these calendars up so that if I want to generate a clinical reminder, I can do that. We're going to go ahead and compile the comprehensive treatment plan for all the problems that she has right now. Once again, it's just one problem. Here we go. We're going to click. Okay. You can see the treatment plan. You can see her diagnosis. Her current medications come forward. Her problem of anxiety shows, and we're going to take a closer look at this when we finish up this note. The bottom information here is really relative to the inpatient setting. I tend to erase this when I'm working in the outpatient setting, so just bear with me here for a moment. Okay, I'm going to go ahead and save this as a progress note. If I wanted to set up a clinical reminder telling me or prompting me for when my treatment plan update is due, I could go into this work area here, but for right now, I'm going to bypass this. And we're now in the treatment plan. Your note is done. I'm going to change the title from plain treatment plan, change note title right here, and say I'd like to call this the master treatment plan instead. Master treatment plan. And I'm going to say that it was done by myself, Liz, as a therapist, an LCSW. So you have control over how the heading displays by either working in these areas or working with custom buttons in each of these areas. I'm going to click continue. And now we're ready to look at our master treatment plan. Here's your diagnosis and current medications. The problem is anxiety. When we scroll down here, you can see her problem is generalized anxiety disorder, with especially her avoidance of social activities. Here's her long-term goal with a target date, her short-term goals with the target dates, her interventions, the status text that we put in, her plan strengths and barrier. Oh, the SNAP scale, which we also put in, which was optional. And then down here at the bottom, the plan strengths and barriers show here. Your master treatment plan is now done, and all you need to do is electronically sign it. We'll go back to the chart face. And here you can see the master treatment plan for Snow White.